Hello, this is Dr. Gay from First Look MRI, and this is the daughter of one of our technologists who's had a mass in the left sublingual region for about a month. It's been treated with antibiotics with some improvement, but it still persists. Also, when she eats, she feels worsening of the symptoms and swelling on the left side. And so we want to look carefully at her salivary tissues and salivary ducts. And on this view, we can see her maxilla up here. You can see her teeth. We can see her muscles of mastication here around the mandible, the body here. And we see the left parotid tissues here looking normal, right parotid tissues looking normal. Now I'm going to go down towards the submandibular tissues. Those are the ones that fit clinically with the symptoms. And sure enough, we see some asymmetry right here. We see some brightness on the left rather than the right. A little bit of fluid around the rim. We see that the left submandibular gland is a little bit swollen and edematous and surrounding fluid. Some of the lymph nodes on both sides are a little bit prominent, worse on the left side, but really it looks like the left submandibular gland is the main problem. It's swollen, it's got fluid around it, and this is a classic example of a duct obstruction. With an obstructed duct, the duct will dilate, and we can see that right here. This is the submandibular duct on the left going across, and it ends about right here. On the right hand side we can see a little bit of the duct looking normal. So it looks like this patient has intermittent duct obstruction causing the swelling and fluid around here. And we'll look at this on another view. So we're going to go to the coronal view, and we can see the right submandibular gland here, little lymph node next to it. That looks normal. You can see the left side is enlarged, little bands of edema within it. You can see fluid around the rim. Classic example of obstructed duct. Lymph nodes scattered around. Now we're going to go forward towards the tongue. Now here we go. This is the tongue, and right beneath it we see an arrow pointing to the dilated duct. This is the left submandibular duct. As we follow this duct out, all the way to where it ends, we see on this view a little dark area. That little dark area is a silith, a little calculus within the distal duct causing the obstruction. Now we're going to go to a sagittal view here, looking at the patient in profile. We're going to go right there, and on this view we can see, if I move that out of the way, the dilated duct. And then right at the end of the duct we see a little rounded area here. This is a little calculus or silith right in there causing the duct to be obstructed and dilated. Thank you very much.